One of the things that Hawaii County Civil Defense got involved with a couple of years ago was when we had a dengue outbreak, which started in the South Kona area, and then there were dengue cases all around the island. Tell us what your current plan is relative to dengue and Zika. And as I ask you that, I have to tell you that I know there was a Zika case on the west side of the island within the past 60 days. Department of Health actually sprayed for it. It was down at the bottom of Palisades, and I was able to confirm with Department of Health that there was such a case, but there was no public notification, and so that really made me curious about civil defense, your role, what kind of cooperation you're getting from Department of Health to be able to share information so people know what's going on relative to dengue and Zika, and what your plan really is for that.
So what's evolved since the dengue outbreak is there's basically a flow chart of what actions we take. They notify this office whenever they have a case, and they've had importation cases pretty regularly. You know, people are traveling the globe into these areas that have, these mosquito-borne diseases, and so every time they get a detection, Department of Health with their vector control folks, they'll go into those areas, and so far they've been able to contain it to the point where there's no island transmissions have occurred. But that's the state we're in right now. If we move into the next level where there's a transmission on the island, then we move to the next level.
And the next level is what?
We'll monitor the neighborhoods a little bit more closer, screen the people, and then just monitor if the outbreak's spreading, or look for, we'd have to interview those people to see where they've been, and it just becomes a bigger case.
Why is either Department of Health or Hawaii County Civil Defense not doing some public notification when there are cases of Zika? Because I know it sort of freaks people out when they see the guys in the hazmat suits spraying for mosquitoes, and yet there's no public notification. I mean, it begins to feel like there's an attempt to hide the fact that we do have imported Zika cases. So why is there not some public outreach about that?
Actually, I'm not sure about how that discussion came about, or how this evolution came about, but there is some public notification because the Department of Health goes to that neighborhood questioning those people there, so that will be the people that will be readily impacted by an infected person in their neighborhood. So there is public outreach.
But not so much if you look at the fact that, for example, I do not live in the Palisades area, but somebody called me and said the guys are spraying. They thought it was dengue, but I was able to confirm with Department of Health that it was actually Zika. But you know how the coconut wireless is. People will say what they will say. Hey, there's a case of dengue, there's a case of Zika. I wonder if Department of Health might not consider working with you a little more closely to just allow some kind of public release that your public information officer could put out, just saying, hey, there was a case of Zika contained in an area, came from someplace else, not spread locally, to reassure people more than alarm people. It probably is a small number of people who actually see those folks in the hazmat suits, but enough that people like myself in the media will get phone calls or queries like, what do you know about this? Because they don't want to feel like something's being hidden. So has there been discussion of being a little more open about these kind of things?
No discussion about it, but we can definitely consider it if, the public, but we've had, like I said, there's been multiple cases of importation, dengue, Zika, and very few calls about, what's these guys doing in our neighborhood. So, based upon the public inquiries, it's like,
You don't think
it didn't seem like there was a concern.
Okay.